There is one particular aspect that is worrying me.
What is it?
Many people resisted the movement of the teaching hospital from Tudunwada to Shika. And from that point to this day, it gave birth to two things. One, shortage of accommodation to staff. Second, bad publicity that the teaching hospital is blood-sucking, death traps, death camps, and all sorts of labels have been given to the teaching hospital. Your predecessors, they did not use this mindset that when you come to Shika, it's just death. What are you doing about it?
Well, one has to be very clear about this. Shika, tertiary hospital, what it means is we still have the primary, secondary care before coming to tertiary. So ideally, patients that come here are patients that are supposed to be receiving tertiary health care and not the primary and then the secondary. Sometimes what happens is, if you're sick, you just go to the Babalaos, then you go to the neighboring chemist. It is only when no one can do anything to the patient, that's when they reverse to the teaching hospital. So even if they call our hospital as a death trap, well, it's not the hospital that did it. It's a patient, because they didn't come early to the hospital. They wasted their money, wasted their time assessing health facility from chemists and whatever. So that's because of the death penalty that's said to say that used to occur in the teaching hospital. This occurs not only to our own teaching hospital, it occurs to all the teaching hospitals in the other part of this country.
This is beyond a public relations department to handle. It is a jinx, and the hospital should not just accept it because you are a tertiary institution. You have to try to use all other gamut of communication managerial aspects, including traditional. Polio was resisted. I remember one of your predecessors was at the national limelight as a pathologist to be able to bring this. But by the time they brought in traditional rulers, the Sultan himself talked about polio and the same vaccinating and number of things, and people keyed in. This jinx is not healthy. We need to see activities that will change this mindset. Do you think you'll be able to break this jinx?
Inshallah, we should be able to do that. It's only when you don't know the cause of the thing, that's when you may be able to correct it. Now we know what is the cause of a patient coming late to the hospital. So we would sit down and then strategize and see how we can educate the populace and make them come to the hospital as early as possible.
I want to bring something back to you again as a medical doctor. You are part of the problem. Many of you are the ones referring patients to your own private hospitals. Most of the private hospitals are owned by staffs of your teaching hospital.
Well, to the best of my knowledge, we do not encourage people to refer patients from the teaching hospital to private clinics. It's against the laws and practice of the hospital. To my own understanding, we are not aware of those referrals. So if they do it behind the management's back. I cannot protest anything on this.